Hello, everyone. This is Dexter Brooks with HealthNetCO Insurance Agency. Happy Monday and happy after Thanksgiving. I hope everyone had a great Thanksgiving. I'm here today to share some update information on Open Enrollment 2021. There's some information that everyone needs to know in order to save cash on their 2021 plan enrollment. Customers receiving financial help could save on their monthly premiums by shopping and not renewing their current health insurance plans. So that basically means when you go into the federal marketplace or the state marketplace, you want to make sure that you are looking at other options. And if you're even accessing our portal, which is connected to the federal, we do also provide rates for states. You want to make sure you're looking at plans that are lower than the plan rate that you currently have. Because on average, people that are financially assisted customers can reduce their monthly premium 13% to 35% if they switch to the lowest cost plan offered by their current health insurance company. Now, those are huge savings. And I want to demonstrate to you exactly how quick, how easy it is to shop and enroll through HealthNetCO Insurance Agency. So what you want to do is go to our website, which is healthnetco.com. And I'm going to add that, show you how that is. There's our site right there. That is healthnetco.com. You want to, once you are there, you want to go over to the Get a Quote button, which is at the top of the screen. Awesome. So once you go into the Get a Quote, we want you to actually go into our main site, and I want to show you how that looks here. Which is our quoting system. You want to make certain that you see our logo at the top. You'll also see my name, Dexter Brooks, which is my national producer number, which is 1569682. Our contact number here is 833-444-4139. That is our toll-free number for every state. We do have local numbers. If you need the local number, you can go to healthnetco.com and locate our local numbers. On our quoting system, you can also change it to, if you speak Spanish, you can click on the Espanol. That will translate the site into Spanish. So that way we're assisting our customers. We're going to go ahead and translate this back to English. Now, you want to enter your zip code. So we're going to start off with a Colorado zip code, 80237. As you notice, the name is optional. The email is optional. The phone number is optional. And at the bottom, it says disclaimer. By submitting your information, you agree that Dexter Brooks or either our associates or colleagues here at HealthNetCO Insurance Agency may contact you at the above listed email or phone number, and that you do understand that consent is not a condition of purchase. So once you input your zip code, you want to click on See Plans and Prices. Here it will take you over to the Your Information screen. The information screen says who needs health coverage. That is where you would input the data based on yourself, your family, your spouse, your kids. So we're going to do an example with a 33-year-old and male. Here, where it says select any that apply, click on informations. Select this if you use tobacco 4 or more times per week for the past 6 months, because you may pay more for insurance, but if you do not report that you are a tobacco user and then you get a tobacco-related illness, you can be denied coverage, okay? And below here is the eligible for coverage through Medicaid, CHIP, Medicare, or on the job. Selecting this options mean you won't be eligible for savings. Do not select this if the insurance your job offer costs more than 9.78% of your pre-tax household income to insure just for yourself. So we're not going to select that. And if you want to add your spouse, just click there. Add your dependent, you click there. For this example, we're only going to do the 33-year-old male, and then you're going to click continue. And this will take you over to the household information. It automatically populates this window with one person in the household, which is the head of the household single. Down below here, it's going to want your 2021 household income before taxes. This includes the taxable income of anyone you're claiming or filing taxes with, even if they do not or are not planning on getting coverage. A guess is fine. Basically, you can do an estimate. Your income will determine if you're eligible and how much savings you're eligible for. So on here, say you don't know your annual income and you know your weekly pay, you can click down here where it says income calculator. And you can input the information per year, per month, per week, or a projection. So we're going to go with $300 per week. And add that. That shows 15. Sounds a little bit too low, right? Let's try it again. Let's go with $400. That gives you $20,800. So we're going to utilize that. Just click on use this amount. Notice it populates back into the field. At this point in time, you may continue. Now you are at the savings page. You qualify for two kinds of savings. You'll save $230 a month. This means you will see plans as low as $13 per month, but you also have what is considered as cost sharing reductions. That means that if you're selecting a silver plan, you'll have cheaper doctor visits, cheaper hospital visits, cheaper prescriptions, lower deductibles, and lower out-of-pocket max. And we want to go ahead and click continue. Now, once you're here, it's going to take you over to the plans that are available for that zip code. You want to make sure your zip code is still the same. See at the top, 80237. Your household size is 1. The person is enrolled and income. If you make a mistake, you can easily click edit right here, and that'll take you right back. We're going to close that. Now here are the plans that are available, 76 within that zip code. Notice that monthly premium is only $13 a month. But say if you don't want to have a high deductible plan, you want a lower deductible plan, or you just want to look at silver plans, you can actually filter. So we're going to filter just here on the left-hand side where it says silver. So it's going to give us all the silver plans. Notice the deductibles are lower, the premiums are a little bit higher, but you're saving more in cost sharing. Now, say if you want to filter your deductibles so you have a lower deductible than $1,000. We're just going to click on the bar here. There we go. Lowest deductible, 0. There's 5 plans in Colorado with a 0 deductible. Now we're going to do a switch up. We're going to change zip codes. We're going to actually now look at the same income based in 2 other states. We're going to go with the first state. It's going to be Georgia, 30032. Savings is higher. Same exact income. So we're going to close this. And there's 29 plans in that zip code. And again, you can filter. You have 29 plans. We're now looking at the silver plans. You have a HMO network. We're going to reduce the deductible down to the lowest, 0, $98 a month. Now, when was the last time you actually had an insurance plan for $98 per month with a 0 deductible? Now, I want you to actually think about that. You can also add your doctors and hospitals. If you add your deductibles and your doctors in hospital, it will filter out the plans that have contracts with those doctors. It also will filter out for prescriptions as well. And we're going to look at a different zip code. Let's look at Texas. Texas zip code 77004. Houston, savings $284. We're going to close this. 37 plans in that area. Same. Now look at this usage estimates. This is very, very important. How much health care do you expect you'll use through the year? If you choose low, that means that you're only seeing the doctor. You're really not seeing the doctor. There's 0 doctor visits, 0 labs, 0 hospitals, 0 prescriptions. Medium, 1 doctor visits, 0 labs, 0 hospital visits, 1 prescription. High usage, 2 doctor visits, 2 labs, 0 hospital visits, 13 prescriptions. This is very important because it's going to show you that information when you actually go in and compare. And we're going to look at this. We're going to reduce this deductible. This is a very low deductible, but we're going to see what the lowest deductible is in Texas. So we're going to scroll down. And there we go. We have a 0 deductible here, 0 deductible here, 0 deductible here. Premium is only 103, 0 deductible, 0 deductible. And you can filter up to 5 plans. So we're going to filter the Molina plan. We're going to filter the Ambetter plan. And we're going to filter, let's see what else we have here. Let's go back up to the top. The Blue Cross. You can filter up to 5, but we can just start off with 3. Click on compare. Notice the side-by-side comparison. It gives you the monthly premium, 102, 114, 73. Your deductibles, your maximum out of pocket, your estimated all in, that's for annual. And right now it's set on medium. Your network, the primary care visits, the co-pays, the specialists, the generic drug prescription costs, the emergency room costs, your hospital stay. You can also download the plan details, summary of benefits, prescription, and brochures. Now, if you see a plan you like, the only thing you have to do next is go ahead and click on Add to Cart. Here it's going to actually take you over so you can shop for dental plans if you want to find a dental plan. Otherwise, you'll start the application process. You click here. And this is very important because when you start the application process, you want to make sure you have all your documents ready. You want to make sure the information you're inputting into the system match your driver's license or the information that you utilize for credit. Because what happens when you click on the agree, you must make sure you read this. And then you click agree and agree. And then you click continue. Then you need to input this information here, your information, your home address, your contact details. Then it's going to verify your identity. What it does when it verifies your identity is it sends this information to the 3 credit bureaus. And the reason is because they want to make sure you are who you say you are. It's protecting you. So it basically, if you had applied for a mortgage, student loan, it's going to have that data and it's going to pull up some questions for you. So you're going to answer those questions. And when you answer those questions, it must match. If it does not match, it's not going to let you move forward. It would then give you a contact number as well as a code where you need to contact that credit bureau so that you can verify in a different manner. Or you can give us a call at 833-444-4139 and we can assist you as well. Once you've been verified, then you can go ahead and move through with your plan and finalize. This process can take about 5 to 10 minutes. That's how quick it is. It goes to the federal marketplace. It goes to the state so that you can actually enroll. If you have any issues, you can always give us a call at 833-444-4139. And again, I'm Dexter Brooks with HealthNetCO Insurance Agency. I hope this sheds a lot of light on how to enroll and save for 2021 plan selections. Again, Dexter Brooks with HealthNetCO Insurance Agency. Our toll-free number, 833-444-4139. Enjoy your week and have a great, great new year if we don't hear from you. Ha ha ha.